Good afternoon. We want to share with you an update on what's happening at Sagepoint. We're taking the necessary precautions to keep your loved one and our staff safe and healthy, and so appreciate your support and cooperation with the many new procedures that have been implemented. We can report today that we have no diagnosed cases of COVID-19 at Sagepoint. Our staff is working to keep spirits up and our residents' routines as normal as possible. Please be assured that we are continuing to deliver the high-quality care you've always expected from us.
We couldn't be prouder or more grateful for all of our dedicated staff who come to work and take care of your loved one every day, despite the concern for themselves or their families. They are truly heroes on the front line during this crisis, and to all of our Sagepoint staff, from Andrea, Denise, and I, and all of the leadership at Sagepoint, thank you.
We also want to again thank our community partners, Charles Regional Medical Center, Dina Barclay and Community Services, Charles County Emergency Services, La Plata Police Department, Charles County Public Schools, and the many additional partners who have assisted us during this time. And to Governor Hogan for his decisive actions that are helping protect the most vulnerable in this pandemic, and his quick recognition that long-term care centers need the critical assistance of the state government. Thank you.
Remember, through the generosity of Charles County Public Schools, we now have virtual visits so you can see and talk to your loved one. To schedule a virtual visit, send an email to chat@sagepointcare.org. Include your name, cell phone number, and your loved one's name. You will be contacted by a staff member to schedule the 10-minute virtual visit.
As time goes by in this health crisis, we want to continue virtual visits for our residents to lift spirits. We've seen many images on social media of children and grandchildren looking through windows at their loved one in a center. For the safety of all of our residents, do not come to the Sagepoint Center at this time unless it is absolutely medically necessary. It is now clear through health experts nationwide that you can be contagious with COVID-19 up to 5 days before you develop any symptoms. By coming to the campus unnecessarily, you are risking potential exposure to your loved one and to our staff who are taking care of them.
According to a new study from NIH, CDC, UCLA, and Princeton University scientists reported in the New England Journal of Medicine, the COVID-19 virus can live up to as much as 3 days on surfaces. For this reason, we are asking you to restrict bringing any food items or laundry to Sagepoint. We have the ability to launder all residents' clothing following very strict infection control methods. While we recognize that snacks from home are appreciated by the residents, we feel that the risk of exposure for them is too great. Thank you for your understanding and cooperation. Once we are through this, we are looking forward to seeing you back here.
Effective March 16th, the governor mandated the closing of all adult day services across the state. All of our families that the center serves have been notified and are receiving wellness checks by phone from the ADS staff. To our families of adult day services, if you need anything, please contact Tammy Parlett at 301-934-6753.
Social distancing. A few months ago, that phrase wasn't even in our vocabulary, and now we see it and say it every day. We have all heard, stay away from crowds of more than 10 people and keep 6 feet between you and another person. And hopefully you are all complying with that advice in your daily activities. Our staff have been instructed repeatedly on the strictest infection prevention protocol, but by the nature of what they do on the job, healthcare workers do not have the ability to distance themselves from our residents. We do hands-on care all day, every day. Another reason our staff are heroes.
Because this is a disease outbreak, all nursing homes in the state of Maryland are required to follow the guidance of the local health department. Should it become necessary, we at Sagepoint are required to follow the direction of the Charles County Department of Health regarding the process of testing for COVID-19, and they, along with the CDC, will make the determination of how we proceed. Be assured, we are doing everything we can to reduce the risk of exposure to our staff and our residents.
Follow us here at sagepointcare.org for all of the latest information. Bookmark it and visit it frequently. We will be posting new information here as it becomes available. Thank you.